For decades, Central Americans fleeing violence and poverty in their homelands, but without documents or money, have made the trip north by stowing away atop freight trains. The ride aboard the trains, known as the Beast, is horrifying. Over the years, many migrants have fallen from the trains or been caught beneath their wheels, losing limbs and often their lives. Criminals have preyed on the helpless passengers who face the threat of robbery, rape, or death. The way north is more challenging than ever. But on the way, the migrants have found signs of generosity. Just outside the city of Cordoba, they are welcomed by 14 volunteers, among them 3 sisters called Las Patronas, that for more than 20 years feed the migrants. They stand 3 times a day, year-round, by the railroad tracks, and when the train passed by carrying with people they knew nothing about, they hand over food and water that were donated by the locals. No international or domestic organization helps them. Those who survived and finally reached Tijuana, the last city before entering the U.S. territory, now have to face new challenges, including keeping themselves alive and healthy. Many of them have had to sleep on the floors for weeks and have walked over 1,000 miles. Throughout Tijuana, volunteers and organizations from around the city and across the border have also been doing their best to provide primary health care since health services have closed down. One of the organizations is the New York State Nurses Association. NYSNA's team, formed by 9 nurses and 1 doctor, during 3 days provided almost 200 medical consultations to patients from 5 countries, in 10 of the 20 shelters across town, with the assistance of local volunteers that helped with translation. These migrants are trapped in Mexico in dangerous health conditions due to the hardship of the journey, being exposed to violence along the northern route through Mexico and living precariously both inside and outside shelters. The patients included pregnant women, families traveling with children, teenagers, and men traveling alone.